CO2 V is an intravaginal formulation of carboxytherapy that regenerates the vaginal tissue inside and outside. It is a suppository gel, and the treatment looks like this. I recommend to do the treatment before bed. When you mix the two packets together in a small bowl for 60 seconds, it's going to form a gel. The small packet you have to massage before you open it. Just make sure it's fully pliable. You're going to mix them together and then draw them up into the plunger. It feels like a tampon. These plungers are sterile, so it does take a little effort just to pull it out the first time. When you draw it up, if you move the syringe around in the bowl as you're pulling up, that will help to reduce air bubbles because the gel is pretty viscous. It's about 2 plungers that will be inserted into the vaginal canal. You push up the gel and you'll add the second one and do the same thing. And the 10 to 15% of the gel that's left over in the bowl, you can use the applicator to apply externally over the labia, vulva, over the hood of the clitoris. It can go back to the perianal and even anal area. It can technically go inside the anus as well. And the way that I like to do the treatment is before bed. It's the least messy. So when I do it, I apply the gel intravaginally, externally, and then I put a little piece of saran wrap over it and then put on my underwear and go to bed. It can stay in overnight. The active carbon dioxide only lasts for 45 minutes. However, the product is safe for the pH of the vaginal canal and safe to stay in overnight. It also contains, as opposed to the Pro treatment, it contains an additional ingredient of mugwort, which is antifungal and antibacterial. And then you will go to bed, wake up in the morning, jump in the shower. If you sit down on the toilet, it might drip out a little bit. But if you jump in the shower, you can rinse it off externally and then put a liner in your underwear and you'll feel it drip out over the course of the next 24 to 36 hours. It does feel just kind of like a little bit more than a monostat, or if you've ever used a different suppository.